Okay. Hey, family, I'm Erin Bull. Welcome to this evening's live chat. This is the COVID-19 conversation. I got a few things, some factual things to go over, and then we'll get into some other, I guess, more opinionated things. But as much as possible, I want to stick to the facts and make sure you have those. Normally I do political updates in my videos, but given the seriousness of this situation, I'm going to skip over that this time. Once we have something to update as far as that goes, I'll get back into that. But I'm going to go ahead and give you the numbers for the coronavirus outbreak globally and locally. As it stands right now, Italy has actually taken the lead, which is actually a bad lead to have. But currently they stand at 74,386 cases, confirmed cases of COVID-19 with 7,500 deaths. Spain has 47,611 cases with 3,445 deaths. And here in the United States, we are currently sitting at 64,100 cases, confirmed cases of COVID-19 and 893 deaths. These numbers were as of about an hour ago when I was preparing for this video. So just a little bit about Italy. They have not reached their or flattened the curve yet. So they're still growing exponentially. So far, the only country that has kind of gotten it under control is China, which is, of course, where this originated. Hey, everybody. And South Korea. And one of the reasons that South Korea was able to get it under control a little differently than any other place in the world is because they actually went about and tested like the whole country and figured out who has it, who doesn't, quarantined those and cared for those that were confirmed positive. So they've been able to flatten the curve and not have such a pandemic as what we're experiencing here in the United States and other countries around the world. Let's see, do I have any other numbers to get into before? Nah. So those are your global and local numbers. All right, so as it stands right now, like I said, Europe is overrun by the outbreak, and we don't quite have accurate numbers for what is going on with China, which is why I did not give you those numbers. Part of the reason that we don't have accurate numbers out of China is because of the censorship. So in China, because the way that the government works, they run everything, all of your utilities, your internet providers and whatnot. So they actually censor people from allowing information to get out. That's why you don't really hear bad things the way that we should. Also, as far as China goes, they did not handle the outbreak responsibly. They actually suppressed the knowledge of the outbreak until it was too late. By the time we found out about China, it had expanded to other countries. And that is subsequently how we found out about the outbreak. What else do we have? So as it stands here in the United States, we have 191 million people currently under some version of a stay-at-home or shelter-in-place order. Of course, the first state to do that was New York. Well, it was New York City, then it expanded to New York State, California, Washington State. Those were the three first responders. So far, we have 19 states, 45 counties, and 18 cities that have been given some sort of stay-at-home mandate, shelter in place, the closure of non-essential businesses and whatnot. There has, up to 5 minutes ago, there have been no federal mandates regarding stay-at-home, shelter in place, not going to work and whatnot. So that's what I want to get into next, because I really want to clarify this for a lot of us that are confused with, okay, are we about to go back to work or what's going on? First and foremost, because there was no federal mandate to close anything, there was no federal quarantine, no federal shutdown. Understand that. All of the shutdowns that we are currently experiencing were done by our local legislators, our governors, mayors, city councils, and those. Like, for example, here in Georgia, Stockbridge is under a stay-at-home mandate. The city of Atlanta is, obviously not the entire state of Georgia. Now, the president did get up there and make some suggestions, but there wasn't any regulations and nobody really had any reason to adhere to it because there was no financial support for that. And when he's talking about trying to open the country back by Easter, he can say whatever he wants to. He doesn't have the authority to do it. As you know, I mean, because there was no mandate, he can't repeal that. He can't rescind that mandate. So you just said something, it's irrelevant. It's irrelevant. But again, this is not even a political thing. This is just understanding facts and fiction. So when the president's up there saying he wants to reopen the country, he can't do it unless the local legislators that closed us down, shut down the businesses, and, have gone down to where we only have support of, essential services open. Those are the people that are going to make the determination. And they are working closely with the CDC and, the doctors, the scientists, the professionals, the people that really know what's going on. And, I get that people want to go back to work. I want to go back to work. So I furloughed, unemployed, whatever you want to call it, because I'm a waitress. So the bar that I work at closed down last week. My last working day was actually St. Patrick's Day. So I want to go back to work, but I don't want to get sick either. So I want to talk about some of these stay-at-home mandates, why they're critical, and what it really means and why we need to do it. So currently, in a lot of these hotspots, I don't know if you are watching the news on a regular basis, but I know if you have turned on your TV to any news channels for about 10 minutes, you have seen Mayor Cuomo, because I thought his name was Cuomo, but it's Cuomo of New York, begging and pleading for assistance. He's begging from anybody, more specifically the federal government, but he isn't. I guess as of now, he's gotten it. Also, pause. So when the president is saying that he activated the National Guard and he relegated the responsibility to the governors and whatnot, that's already the process. He just approved the deployment of them. But a lot of the states that have declared states of emergencies and whatnot, that's part of why they did it, so that they can use the National Guard. But okay, there's clarification on that. Also, as far as adhering to the stay-at-home mandates or shelter in place, or adhering to social distancing guidelines and whatnot, the reason that we have to do this is it's a myriad of reasons. But one thing I want to clarify: when people talk about, we don't shut down for the flu, when you have the flu, you have it. Period. With this COVID-19, number one, there is no vaccine to it. And in reality, it's not even really any treatment for it. But it's like the flu. There's no treatment for the flu. That you treat the symptoms and then you just kind of wait it out. Now, if you have underlying health issues and whatnot, then there are other things that can be aggravated by you having the flu or any type of virus. But there's no cure for that. So if we go back to work too soon, number one, we haven't gotten the hospitals and whatnot down to capacity to be able to deal with the influx of the COVID-19 patients. And also what you have to look at is, if we overrun our hospitals, healthcare workers and whatnot, because it's so many different dynamics. So I'm going to try and take it slow. I'm really passionate about this. But all right, number one, you want to make sure that you have enough beds, facilities, masks, ventilators, everything that you need to provide care. We have inadequate testing in the United States as it stands. Let's see, do I have those numbers? I should have had those numbers. I'm sorry, I don't. But we are definitely only testing maybe about 2,000 people a day, maybe. And I think that's a high number. But if we cannot test people, you don't know, like the confirmed cases is still lower than what it really is. And again, one of the issues with COVID-19 is that you can be a carrier of this and not know it. So you can feel fine. You can actually contract COVID-19 and have little to no symptoms, or with it being pollen season, You may just have regular allergy response to it, but that's you. And then you carry it to somebody else who has underlying health issues that none of us are aware of. Maybe they're not even aware of. So they may not respond as well. Also, with the hospitals and all of that, those kind of things, let's see. Why are we trusting people who are infected to quarantine themselves? That's part of the reason why we need a national mandate. Because, we're Americans. We're headstrong, home of the free, land of the brave, all that kind of stuff. So we hard-headed. We're stubborn. We just like that. Ain't nobody going to tell us what to do because we're just Americans. But it's bigger than us. And it's bigger. Nobody has seen an epidemic like this. You know what I'm saying? I mean, the only type of thing that they can refer to is the Spanish flu of 1918. Who was there? Is anybody? No. And we have a different level of technology. We're in a totally different world at this point. You know what I mean? So we just have to take responsibility. And the way that I look at it is everybody just has to conduct themselves as if they have it and they don't want to give it to those that they care about, or they don't want to give it to somebody else. Because me personally, I would not want to be responsible for giving somebody an infection that they may not recover from. I don't want to give anybody an infection, period. But certainly not something that, is preventable. I mean, so for right now, we need to shelter in place. We need to stay at home, practice social distancing, and, adhere to the CDC recommendations and listen to the actual professionals, people that have, those beautiful letters behind their name, PhDs and all those kind of things, I mean, because never mind. But, and also with that, if we should all shelter in place for a short amount of time, and I know 3 weeks is a long time, especially when you're not working, like in my case, even if they pass this stimulus that still has not been approved yet, I probably won't get it. I didn't file taxes in 2018, and I don't have any verifiable income right now. So I'm not banking on that. So with that being said, I definitely want to get back to work. But I don't want to be exposed or expose others. I mean, obviously, you're not going to carry it out of your house, but you might run into somebody or pick up something, pass it. It's a lot of unknowns with this. So we have to proceed with caution. And if we take this time and just shelter in place, stay at home, practice social distancing and those things, and allow our healthcare systems and healthcare workers to recover from the influx of patients that they're getting now, then when we go back to work, there will be a spike. There will be another spike in this when we return back to work. So it's not just we just going to shelter in place for three weeks to a month and then there's no worry. No. But at least we can give our systems, our healthcare systems, healthcare workers, frontline workers, an opportunity to recover so that they can handle the volume. Because right now they are running out of space. They are running out of beds. We are at the point of having children sewing masks for our doctors and nurses. Doctors and nurses are reusing supplies, using expired supplies and things like that. This is serious. And also, I want to talk about living in caution versus living in fear, because part of this is like why people don't adhere to the quarantine or the social distancing and stay at home mandates is because they don't want to live in fear. I get that. But there's a such thing as living in fear, and then there's a such thing as living in caution. Cautious of what you do, where you go, and just limiting your exposure. Because again, nobody has any control over how it affects you. You know what I'm saying? Because it's just like, if somebody has a cold, how a cold will hit you, regardless of what your situation is and whatnot. If you get a cold, you get them really bad and it's hard for you to recover. Or if you just got to, take a day off, or some of us, typically women, don't take days off and just push through it. You know what I mean? But you don't know how the COVID-19 is going to affect you. So it's not about living in fear. And I am no fan of living in fear, but I do believe in living in caution. And you have to live in compassion. You know what I mean? It's a little inconvenient being stuck in a house every day. Oh Lord, I was trying to shield the sun. Thing and fell down. But it's a little frustrating to change your routine, to really be stuck in the house, which, I'm a homebody anyway, but it does feel differently when people are telling you to stay at home. Like suddenly you can figure out that you should have done. Maybe I need to do this or I need to do that. But that's just one of the things that we have to do because, you don't have any control over who gets it. Nobody's safe at this point, meaning, there were rumors that, Black people can't get it. Young people can't get it. It's only for old people or people with underlying conditions. Then the list of underlying conditions that could be affected by COVID-19 grew. Because at first it was just like, if you're old and, limited lung capacity. If you have, but now they starting to add like high blood pressure, diabetes, and things like that. Typical underlying conditions that you may just take medication for and really not suffering. Now you can track this COVID-19 and it's hitting you a little different, so you have to take those things. And what else? I just want to make sure that I'm giving y'all all the facts. Oh, also another reason that we need to shut down is to allocate reallocate the resources and whatnot. So for example, about like Iowa, Idaho, or Wisconsin, or one of those places that have like just a small outbreak. Okay, if that's the case, go ahead and shut that state down now and figure out if there are any available doctors, nurses, pre-med students, or anybody about to graduate in the medical field, and then send those people to the hotbed places like California. It's 40 million people in California. You know what I'm saying? New York, things like that. Because that's what they signed up to do. And I'm not saying just send them to die, but you want to make sure that they're prepared as well. So for these places that don't have a lot of outbreaks and whatnot, then go ahead and issue a stay-in-place mandate, figure out what kind of resources they can give up to fight this pandemic and still maintain the regular day-to-day, patients and things that they have to see, the heart attacks, car accidents, gunshots, pregnancies, regular life. And again, that's something else you have to take into consideration when it comes to staying in place, because it's bigger than just staying in place for, I don't want to get COVID-19. You need to minimize your exposure of anything that could cause you to need to go to the hospital, because we need to avoid going to medical services as much as possible. Now, what I'm saying is putting ourselves like not getting injured, not getting, headache, car accidents, heart attack, things that, you might encounter going through your day-to-day, so that the hospitals and doctors and frontline workers and whatnot can deal with the regular day-to-day as well as the COVID-19 influx of patients due to COVID-19. So I'm not going to keep you guys for too long. I just really wanted to make sure that we got some understanding. I did not cover the supposed economic stimulus because it has not been approved yet. There have been about 3 or 4 different versions of it. So I don't want to present it to you and tell you, this is how it's going to work. This is what's going on until it's signed. So once we have a signed agreement, we'll revisit that. Also, like another reason for the stay-at-home mandate, I'm so sorry, but I need people to understand we really need to like shelter in place, stay at home. You have Louisiana with an explosion of cases right now. As it stands, Louisiana has the highest rate of COVID-19 per capita. That means, based on the amount of people that they have in that state versus the amount of cases, it's mismatch. And it's actually the highest rate in the world at the moment. So that doesn't mean that they have more cases than anywhere else in the world, but it's based on, the population versus confirmed cases, which again, this is another reason why I am in favor of testing as many people as possible. Now, I get that it utilizes resources and whatnot, but that is where leadership needs to come into place and mandate, okay, these are testing facilities, and then you send, the confirmed, if they have, other symptoms where they need to be hospitalized, then they go to the doctor. But, just do a drive-through testing so how many cases you actually have, because again, you have a lot of people that contract this and they are asymptomatic, meaning they are showing no symptoms at all. And they may not even really be affected, but now they're a carrier and passing it to others. But nevertheless, like I said, I'm rambling. I know it's Wednesday night. I didn't want to be on here for too long. I wanted to make sure that we got the facts, some understanding on this. I'm going to go through, read my comments, see if y'all have anything to contribute. Let's see what we got. All right, so we got Berlin Willis Stacy. Hey, family. I don't think this virus can be put under control. The virus cannot be put under control until people make a concerted effort to get it under control. Right now, we do not have a vaccine for it. You know, they have no declared drugs that can actually treat this. And again, it's a virus. So you literally have to wait it out and just treat the subsequent symptoms that come from you getting the virus. You know, so if you contract it, it may send you into, you know, respiratory arrest or something like that. So they would treat those symptoms. That's part of the reason that, you know, they need these ventilators and whatnot. And again, that's why we need to stay home until we start to see the curve flatten out. And we will not see the curve flatten until we test as many people and we get true confirmation. All right, we have tested the maximum people in this state. These are the confirmed cases. These are the critical cases there. So once we have that understood, you know who has it, who doesn't, then you can slowly but surely ease us back into work. But if we go back to work in 2-3 weeks and we have no idea of where the disease is or where the virus is taking place, is where the hot spots, you know, then we won't get it under control. Eventually we will, because there'll be a vaccine, and then there'll be enough people that actually have contracted it and survived, and now they've built an immunity to it. So, you know, it's levels to it. It's a lot of levels to it. And what else? My heart goes out to everyone that has been affected by this pandemic. Absolutely. Absolutely. Because a lot of people think that it's just about those that actually contract it. So, not to be morbid, but again, I'm here to give you the facts. So right now, if somebody passes away, in a lot of places, you can't even have a funeral. Or the funeral be online, or, you know what I'm saying? Like, funerals draw large numbers of people. You can't do it right now. You can't do it right now. And not just from the COVID-19. This is just somebody passing away, just through natural whatever. This is another reason we need to stay at home, stay healthy, so that we can minimize these experiences. Because, baby, if somebody close to me pass away and I can't participate, I'm not going to be right. I can't, you know, pay my final respects or whatnot, and not have that closure until months later when let's not put people in it. Let's not put ourselves in that situation. And speaking on that, again, not to be morbid, but to be honest, people are concerned about the activation of the military here in the United States. But currently, the United States military and the reserves, National Guard, all of those service members are coming to help fight the coronavirus, whether it's building facilities, helping transport people, actual doctors, nurses, and things like that, because they do have those in the military, building shelters and all of these kind of things, these proactive things, which I'm happy to see. Otherwise, we could be like Italy, who had to activate their military to haul away the large numbers of dead bodies. In Spain, the death rate is so large that they are using ice rinks as temporary morgues. And you still can't go visit them. And I guess on a lighter note, even for those that don't die from it, if you have a family member that gets sick and has to go to the hospital, you can't visit them. They may let you escort them in to do the paperwork, depending on how critical they are. But you're not going to be able to just stop by, making sure that they eat and keeping them company and whatnot, keeping people safe and sane while they're in the hospital. And anybody knows moral support is the best medicine when you're in a hospital. I mean, no knock to the stuff that you get while you're there to help you, but it helps your mental to fight. You know what I mean? So let's stay home, keep people safe and sane, and do what we need to do until we really have an understanding of this pandemic and how to deal with it and how to avoid the side effects and whatnot. Let's see. What do we do when America runs out of food? America will not run out of food, no matter what. Food is in grocery stores are considered an essential service. So no matter how strict the mandate gets, even if they have to escort workers to and from the stores or the DCs, then that's what we'll do. But they're not going to shut us off from food. However, learn to grow things, fruits, vegetables. If you have land, farm. You know what I mean? And I'm not even being funny. I know that sounds sarcastic, but no, that's a real thing. Like, you can really take this opportunity to learn to be self-sufficient. And you never know. You might find your green thumb or I don't know what to call it when you're good at raising, but your ranch hand, I don't know, and learn how to farm, learn how to raise cattle, and all of a sudden you have your own business. That's something to think about. Kumo needs a lot of ventilators in New York. Yes, my hat's off. Let me tell you something. If Kumo was running for president right now, he would get my vote, baby. I salute him. Salute him. I mean, this man has been on TV day in, day out with some of the most passionate pleas I have ever seen on behalf of his entire state. You know what I'm saying? I mean, he is making it known, and I appreciate his transparency in this situation. You know, letting us know what is going on, how this virus is affecting his state, and how it will affect other states. Also, while I'm talking about affecting other states, that's another aspect of why we need to stay at home. Because, you know, those of us that want to work, especially some people that have the freedom to up and go, if Georgia is on a lockdown, which we're not, but say we were, if Georgia is on a lockdown and Alabama's not, I'm going to go find me a job in Alabama. So, because Alabama doesn't have a lockdown. They're not checking to see where you coming from and whatnot. And, you know, it's actually commonplace for people to transport or commute between states from Georgia, Alabama, vice versa, South Carolina, maybe even North Carolina, because, you know, it's only a couple hours. Some people will do that. And especially when you're trying to feed your family. So, you know, I mean, I that's just a fact of life. People are going to find a way. So if we have just individual states doing lockdowns and whatnot, but we're not locked down as a country, you're still putting those other states at risk of explosions of the pandemic in those states. Because now you have people that are coming from lockdown states. Maybe they have a high virus count there. And now they're commuting to lesser or to a population with a lesser virus count. So there's that. But on a lighter note, I don't want to leave everything all heavy and dark and whatnot. Some other things to consider while we are staying at home is to make the best of the time. You know what I'm saying? Don't sit there and think about how miserable it is. You know, oh, I could be doing this, I could be doing that, worrying about bills and whatnot. Because trust me, I'm one of those. I'm one of those. I'm like, oh man, I need to make some money. Like, I stayed up to 6 o'clock this morning putting in job applications. I'm trying. But you can't just stop living, even though you have to change your way of life. It doesn't have to be the end of your life. And don't let somebody get up here on your TV and talk about, oh, people are going to die if we don't go back to work. That's a narrow-minded mindset. You know what I mean? There's more to life than just money and material things. I don't want to see anybody lose their housing or, you know, anything else that comes from not having money. Nobody wants to see that. However, if you have breath in your body, you still have reason to be thankful. And there's an opportunity to get back to it, because this is not anybody's fault. There wasn't any real way that we could have avoided it. Now, granted, if you want to be that person, yes, we all know we should have 3 to 6 months of money reserved for situations like this. But who could really predict that? And also, who's making that kind of money all the time? I'm not one of those. You know what I mean? I'm working to do the best I can to save up, but it is what it is. So just make the best of the situation. Check on your people. I mean, I cut up with my old folks. They, Lord knows, they get on my nerves. They snuck out the house today. I wake up, they gone. Talk about you want something from Taco Bell. Y'all are not supposed to be out the house. So they came home, I sanitized them, sat down, chopped it up. Just make the best of the moments that we have, because a lot of us that do work all the time and have a strong work ethic, we focus so much on working that we forget about a lot of our relationships, and we don't make time to maintain those relationships. So we can do that now. We can do that now, because it doesn't matter if you white, black, red, orange, yellow, blue, green, Democrat, independent, Republican, whatever, rich, poor, we all in the same boat. We all in the same boat. Money can't buy you out this situation right now. Now, it can maybe stall you out of some things down the road, but we in this together. So, don't feel like you alone. Check out Instagram, YouTube. You got a lot of DJs trying to fill the void right now that are spinning some real nice sets on Instagram. And that's why I'm going to jump out of here, because I know a lot of people want to go and check them out. But, phones still work. Live videos still work. Video chat with your family. Check on them. Go ahead and take the 5-10 minutes that you never had time for before and just say, hey, how you doing? What you got going on? Make sure you're going outside from time to time. Get you some vitamin D. Here in Georgia, it's beautiful, 75 degrees. If we ain't got no rain today, thank you, because we had some storms blow through here yesterday. Go for a walk. Staying at home or sheltering in place does not mean you have to be miserable. Don't let it make you miserable. Take some time and explore yourself in some of the ways that you like, when I get time, I'm gonna figure out this, figure out that. Are you chasing your passion? What kind of crafts do you have? What can you do now that you didn't do because you didn't have the time, or because you didn't take the time? You've been given time now. So make the best of it. But nevertheless, guys, I'm gonna get out of here. I said I wasn't gonna hold y'all for too long, about 3 minutes, a little bit longer than what I wanted to. But I appreciate y'all as always. Thank you so much for checking me out. I will keep you updated. Hopefully there won't be any negative or nothing bad to cover about this COVID-19 pandemic. But, I'm here to tell you the facts. My slogan is sometimes funny, sometimes serious, always real. And I'm always going to be real with you. So I appreciate y'all taking time out your day, checking me out. And for the next video, the next live chat I do, we're going to be talking about love and relationships. So we're going to change it up a little bit. We're going to get out this politics and, virus and whatnot. We'll keep our eye on it, but we're not going to get bogged down with it. So we're going to talk about love and relationships. I haven't done one of those in a long time, but we're going to talk about it. But nevertheless, before you leave, please let me get a thumbs up on this video. And if you are watching this and you are not subscribed, please subscribe. And thank you again so much for your time. Thank you for watching. As always, I am Erin Bull. Y'all have a great day. Stay safe, stay sanitized. Oh, it didn't end. I better wait. Did it end? Oh, what's going on? Can y'all still see me?